All right, for those of you who don't want to spend $200,000 on dry eye, we could do this, the earliest part with fluorescein. Everybody's got fluorescein. A flashlight. All right, it's a transilluminator. And a finger, and you got like 10 of those. Hi, Dr. Brill here. I want to go over the 3 F's of dry eye analysis for doctors who don't really have a passion for dry eye. Yes, I know we're supposed to everybody look at dry eye and have a dry eye practice. My goodness, every article almost in every journal and all the lectures are about dry eye, but I know a lot of people don't like dry eye. Okay, so I have a confession. I'm a dry eye guy. I have just everything relating to dry eye. I've spent a couple $100,000 on it. I've got Blefx, new lids, LipiView 2, LipiFlow, Luminous M22 IPL, Zocular Zest, heated iPads, iLux, Meibomian gland evaluators, Tear Lab, and that doesn't include all the treatments, nutritionals, protocols, drops. So I've got everything in there, but I realize that not everybody likes dry eye. But let's call it the 3 F's of early dry eye analysis. So let's go over this. So every time I'm at the slit lamp, I will use a finger to have the patient look upwards, and I gently press on several areas of their lower lid to try to express some oil out of their oil gland. All right, now I'm going to demonstrate how to use your finger on your everyday routine exam on our model, Kelly Deering, who's our summer extern here at Brill Eye Center. So we're using her lids, and she does have a little bit of blepharitis, so we'll just overlook that for now. And okay, so Kelly, let's just have you look up to the ceiling, and I'm just going to gently press on your eyelids here, and to see if I can get any oil to come out. And indeed, I am getting some oil to come out, and it's also pretty clear, which is good. All right, so it doesn't take you long. A lot of times you could just do it on 3 different places. I'm being a little more. So it's a gentle push, and it's right at the lash margin there. I'm using about a 10x magnification, and that's really about it. If I get nothing, then I know their oil glands are not working, and quite honestly, your finger will be a little bit more powerful than an official Meibomian gland evaluator. And you're also going to look right there, do they have rosacea on their lids? All right, so that's the finger, so that's pretty easy. You're already doing slit lamp on everybody anyway. Fluorescein, if you put a fluorescein drop in there, either a drop or use a fluorescein strip, you're going to pick up if there's any staining. You're going to do tear breakup time. How long is that going to take you? 10 seconds? It may take you 3 seconds. And you're also going to see if there's any other abnormality. Perhaps they have MAP fingerprint dystrophy. So that's just part of your normal care regimen. All right, so we have Kelly back, and we've already put fluorescein in. Everybody knows how to do that. So I'm just going to be looking at the stability of the tears and looking for any staining defects. I'll be also looking at the tear wedge, and I look for something called conjunctival chalasis. For the Europeans, that's your lip cough sign. So, all right, so Kelly's here. We're going to start with just the regular blue light, and then I have a built-in Ratten filter in my Topcon SLD, but let's show how it is with the filter in there. Go ahead and put the filter in. Okay, let's take the filter out. Okay, and put the filter back in there. Now let's do it with the lights off in the room. Okay, so go ahead and blink, Kelly. And let's try the filter out and see if you could tell. Now you'll see Kelly has a pretty short breakup time here. So go ahead and blink once, and then let's see how long your tear breakup time is. Okay, so about 3 seconds. So she's got a really good tear wedge, and so that's all you would have to do. As long as you're here, though, I might just add a little bonus to this and look at the inside of the lid and see right there if there's any lid wiper epitheliopathy, but there is none, fortunately. Okay, so very good. So finger, flashlight, and fluorescein. Let's look at the flashlight part next. Now, the flashlight, All right, this is a little bit more complicated. You're going to have them close their eyes and see if they keep their eyes open at night. All right, now I mentioned a flashlight. I really meant a transilluminator, and this is how it works. So you're going to have the patient close their eyes. Now it helps if the chair is up and you're looking down below, and you're going to see if you can see that patient peeking once you have your transilluminator on. If they can peek and you're going to see their eye glistening, you can assume that they're probably keeping their eyes open at night. Now part two, everybody knows this part for nocturnal lag of ophthalmos, but part two has to do with really seeing how their eyelid seal is. And for that, you're going to actually have them close their eye, and it's hard to do this yourself, and you're going to focus the light toward the middle of the lid, and you're going to see if you can see light shining onto the cheek. You're going to see actually if light is leaking, and if light's leaking, then air is leaking there. So we call this a bad eyelid seal. And the analogy I like to look at, you close your refrigerator. Let's say you got an old one that you keep in your garage. You close your refrigerator. It looks like it's closed, but you look from the side and that magnetic seal is just not really good. It's scalloped. So a lot of people, while it looks like their eyelids are closed and they don't have nocturnal lag ophthalmos, they actually have an air leak. They have a leakage of air drying out their eyes. Usually you could see this, but they'll have some inferior corneal staining. Okay, so now we're going to do the flashlight part of the transilluminator. I've got it turned on. I've got Kelly already high in the chair, and we're just going to ask you to close your eyes. So here, I'm going to turn the light off, and I'm going to look to see below if I see her eye glistening, and actually I don't see her eye glistening. So the next part is I'm going to say, okay, Kel, I'm going to put my light right on your lid here, so don't get too startled. And when I put it on her lid, I can see that some of the light is shining through at the bottom. So that's going to have, and I'm emphasizing a little bit more here. And that's going to indicate that there's possibly an eyelid seal that is not perfect. Okay, and as I mentioned, it's kind of similar to looking at the refrigerator magnets. So if you see lower corneal staining, then most likely it's from exposure at night. And there's all sorts of things you can do, but the purpose of this video is just to make it really easy for you. You have the 3 F's of dry eye. You don't need to be a dry eye guy or gal. You just really need to use your resources and finally tell people if they probably have a dry eye. And if you don't want to go any further, you're in a practice where you just do routine care, please refer them on to somebody else who has a passion for dry eye. They're going to honor your referral, and you make sure that they do, or you'll never refer back to them. So you're going to provide much better care. The patients will be appreciative. After all, we have 30% of the population in the U.S. has dry eye. I mean, this is millions of people, and a lot of them don't know it. They have what we call non-obvious dry eye. So that's your tips. 3 F's of dry eye analysis for routine practice.